Welcome to the page on diabetes or prediabetes. My name is Dr. Qaadri. The number of people suffering diabetes continues to explode. More than 3 million Canadians have diabetes right now, and even more are pre-diabetic, which means they have diabetes in training. If they don't take care of themselves, they'll develop the full condition with time, usually a matter of a few years. What happens to the body in diabetes? Candy-coated organs. Just as you can dunk an apple in liquid sugar and get a candy-coated apple, similarly you can get candy-coated organs. When a person's sugar remains high because of diabetes, the heart, kidney, eyes, nerves, blood vessels, cells, all of these become sugar-coated. And sugar-coated organs and cells don't function, don't work properly. Understand, diabetes makes all of these organs and parts wear out faster. Diabetes causes heart disease. People also need to understand an important message, that diabetes is heart disease. Diabetes, of course, causes more also: kidney disease, amputations, erection problems in men, visual impairment, and so on. But diabetic patients should understand that most diabetics will have their major problems with their hearts. That's another reason why heart disease is still Canada's #1 killer. What doctors regret that many heart attacks could have in fact been prevented, but people are still not getting the message. The cardiometabolic syndrome. It's also very important to understand that many conditions collect together to cause the cardiometabolic syndrome. With obesity, high blood pressure, high cholesterol, high sugars, all mixed together, people have an extremely high risk for developing heart attacks, strokes, and even sudden cardiac death. To figure out if you yourself have a high chance of developing diabetes, we doctors ask a bunch of questions. In our own minds we say, I wonder if this person is en route to eventually developing diabetes. Will this patient who's sitting in front of me be one of the ones to clog his blood vessels and damage his heart or have a heart attack or a stroke because of diabetes? The questions that follow are the questions that we ourselves ask. You should use this list of questions yourself. The more yes answers, the higher your chance of having diabetes and having a heart problem, stroke, kidney damage, or sudden death. What's important about lists like these is that they help you to rate yourself. It helps you to understand the kind of questions that we doctors use to find people who are in danger. Diabetes risk test, diabetes quiz, diabetes questionnaire, diabetes risk analysis. Here are the questions. Are you male? Are you a man over 35 or a woman over 45? Did your relatives, for example, parents, brothers and sisters, uncles and aunts, have diabetes or heart disease? Did you have a sugar problem when you were pregnant, known as gestational diabetes? Did you give birth to a large infant who weighed more than 9 pounds? Do you smoke? Have you smoked 10 cigarettes per day for 10 years or more? Are you overweight? Are you obese? Is your waist measurement more than 35 inches or 89 centimeters for women, or 40 inches and 102 centimeters for men? Do you exercise infrequently? Do you have arthritis that limits your mobility? Are you under too much ongoing stress? Do you argue and get angry very often? Do you eat too much sugar? Do you eat few fruits and vegetables? Do you drink too much alcohol, 3 or more drinks a day? Do you have high blood pressure, hypertension? Do you have poorly controlled high blood pressure, well above 130/80? Do you have high cholesterol? Do you have kidney disease because of high blood pressure or diabetes? Are you depressed, sad too often? Do you have erectile dysfunction, problems with sexual performance? And are you from a high-risk ethnocultural group, for example, Black, African, Caribbean, or Chinese, South Asian, Hispanic, or Aboriginal? As you answer yes to more and more of these questions, you have a higher and higher chance of having diabetes. The message to you is to see a physician and learn what you can do about protecting yourself. The other special point is that you don't need to have too many yes answers to start having more and more risk. For example, being male is one risk factor. Being over the age of 35 is another risk factor. Being overweight or under too much stress are also other risk factors. So the entire list can collect quickly and apply to huge numbers of people. We doctors believe that if you answer yes to 3 or more of these questions, you need help. You should begin the process of understanding your personal risk, your personal chance of developing diabetes. Understand, having diabetes is as if you have already had a heart attack. Act before it's too late. Beyond the hype and scare tactics, this is a really important and essential message that too few people are benefiting from. Learn your risks, take appropriate action. This will include getting yourself fully tested and will likely include taking particular medications to protect yourself. Symptoms of diabetes. What will you experience with diabetes? There are a number of symptoms, which include being too thirsty, urinating excessively, losing or gaining weight without any diet changes, feeling tired easily, blurry vision, frequent infections that just don't go away, cuts and bruises that take too long to heal, numbness and tingling in the hands and feet, erection problems. Along with diet, exercise, and weight loss, medications are the mainstay of treating diabetes. Super test of diabetes, the hemoglobin A1C, the glycosylated hemoglobin, sugar-coated hemoglobin. Another extremely important test to know exactly how your sugar is doing is the hemoglobin A1C test, or the glycosylated hemoglobin, or how much your organs are getting sugar-coated from the inside. This is the gold standard that we doctors use to see if a person is en route to developing the complications of diabetes, including heart disease, kidney failure, visual impairment, nerve damage, and blood vessel clogging. This tells us much more than even a sugar pinprick test or even a glucose test done at a medical laboratory. This test, the hemoglobin A1C test, is extremely important because it tells us how the previous sugar has been doing over the previous 3 months. It's even more important than the morning fasting sugar test that you can do. Results for this special test of the hemoglobin A1C are less than 6% is ideal, less than 7% is good, going higher than 7% points to inadequate sugar control. More than 8.5% is very poor control. Once again, this is the best test to assess long-term sugar control, which means long-term protection against all complications of diabetes. It would be helpful to all concerned if patients themselves started learning the lingo, started learning more about the tests we doctors use to measure sugar control. The whole point of all this testing is to make sure that your sugars are close to normal for as long as possible. This is called tight glucose control. This will help protect you, your organs, and give you a longer and healthier life. This is a major message, also still to be fully appreciated by people. In terms of controlling your sugar levels, it's important to take this message to heart.